Imagine you are enjoying a remote hike, far from any paved road, when a companion takes an unexpected fall and clearly has a leg injury. Your immediate thought might be how to keep them safe and prevent any further harm. To stabilize a broken leg with an improvised splint, your main goal is to gently immobilize the injured limb by securing it to a rigid support. This minimizes movement and reduces pain, providing crucial temporary care until professional medical help arrives. Immobilizing a suspected fracture is critical because any movement of the broken bone ends can cause significant additional damage. This could mean tearing muscles, puncturing skin, or injuring vital nerves and blood vessels. Effectively, proper stabilization prevents a simple break from becoming a much more complicated and dangerous situation. First, assess the scene for safety and reassure the injured person. Gently gather your materials, which should include a rigid support like a sturdy stick, a rolled magazine, or even a folded blanket. You will also need padding such as soft cloth or bandages, and tying material like strips of fabric, tape, or rope. Once materials are ready, carefully position the injured leg as found, avoiding unnecessary movement. If possible, have someone gently hold the leg to prevent it from shifting. Place padding around any bony prominences and between the limb and the rigid supports. Now, apply your rigid supports on either side of the leg, ensuring they extend beyond the joints above and below the suspected break. Secure the supports firmly but not tightly with your tying material, making sure to tie knots away from the injury. An important technique often used by first responders is checking for what we call CSM, which stands for circulation, sensation, and movement. After applying the splint, check for a pulse below the injury, ask the person if they can feel your touch, and see if they can wiggle their toes. This confirms the splint is not too tight and blood flow is not compromised. If you do not have rigid materials, you can also use what is called an anatomical splint by carefully binding the injured leg to the uninjured leg for support. Effectively stabilizing a broken leg in an emergency can significantly reduce pain, prevent further injury, and make the subsequent medical treatment much more straightforward. By following these steps, you are actively protecting the injured person and providing valuable time for professional help to reach them.